Assalamualaikum and good day to Dr. Husna and Dr. Huzwa. So I'm Amirul and I'm with my partner Chong Shen Yi. We are going to discuss about drug-nutrient interaction for our clinical assignment for drug and nutrient interaction course for this semester. And this assignment was assigned since the beginning of the semester, and we did our clinical visit since few weeks ago. Yep. So the outline for the presentation today is client background, disease introduction, mechanism for drug nutrient interaction, monitoring and evaluation. So yeah, let's enjoy. So regarding the client history itself, the patient has underlying disease which is hypertension and cataract, and it is still under the follow-up with the ophthalm in Hospital Sedang. And then the patient also already did 2 times scope, where during the first procedure the patient didn't give cooperation and the first procedure was stopped. So actually the patient has a suspected issue of chronic ulcer and pyloric cancer, but it is not confirmed. So from this client history itself, we will see more about the drugs regime later on. Yep. So the vital sign and all is stated inside the slide itself. Yep. So the anthropometric data shows that the patient actually lost more than 10 kg in 3 months, and it is a very significant loss of weight. And the current anthropometric data of the patient is the weight of 39.8 kg, height of 1.5 meter, and the patient is underweight, which is 17.69 BMI. So the food intake of the patient during the visit itself, we found that the patient is on TPN, and the patient take Nutriflex Lipid Peri, and the total energy prescribed for the patient is 1,532 kcal, and the total protein is 60.8 gram. Yep. So moving on to drug regime of patient.
So, hi doctor, I'm Chong. I will continue to presenting about the drug regime of patient. So in this patient, there are actually 2 drugs being prescribed, which is amlodipine and pantoprazole. So through our reading, amlodipine was actually prescribed under maximum dosage recommended, which is 10 mg per day. And then secondly, for the pantoprazole, they were actually being prescribed parentally. However, the treatment of duration was not being specified in the medical record, where through our reading, we found that normally the suggested duration of treatment for pantoprazole was actually 8 weeks, but in this case itself, it is not being specified in medical record, and we didn't manage to find out. Yep. So moving on, we will we'll have a short video in terms of introducing the disease that the patient have, which is hypertension and cataract. So moving on, we're actually preparing another video to explain on the pharmacokinetics and pharmacodynamics of the drugs prescribed in this case, which is amlodipine and pantoprazole. All right. So thanks for watching the 2 videos just now, and then next I will be presenting about the possible interaction of drugs and the monitoring from DNI for the drugs. So in this session, I will be presenting for amlodipine, and then Amirul will presenting for pantoprazole. So for the drug nutrient interaction of amlodipine, if amlodipine was being consumed with multivitamin and minerals, that actually can decrease the effect of drugs, especially for calcium-containing products. It may decrease the effectiveness of calcium channel blocker by saturating the calcium channel with calcium. And second is when consuming amlodipine with grape juice, because the substance in grape juice will actually cause inhibition of CYP450-3A4 mediated first-pass metabolism in the gut wall, and thus it will actually increase the plasma concentration of amlodipine, and it might increase slightly the risk of toxicity. So moving on is a drug to disease interaction of amlodipine, where amlodipine shouldn't be consuming with the patient who have hypertension, coronary artery disease, and liver disease. This is because in hypertension patient, using of calcium channel blocker will actually further depress the cardiac output and blood pressure, which will complicate the symptom. And for coronary artery disease, it happen really, but it will increase the frequency, duration of severity of angina and acute myocardial infarction. For patient with liver disease, the half-life of drug will actually prolong due to the hepatic impairment, and this might complicate the hepatic impairment of the patient. So for the monitoring and evaluation for amlodipine, the effectiveness of drug should be observed or should be monitored when they are eating, the patient are eating with calcium containing product, and or they are, if they are eating with grapefruit juice, to ensure the blood pressure is being maintained in an acceptable range. And then the monitoring for the calcium channel blocker drug adverse effect such as headache, hypotension, syncope, tachycardia, edema is recommended. Lastly, the timing of administration for this drug will not actually affect the effectiveness, so it can be consumed either before or after the meal.
All right, moving on into the DNI for pantoprazole itself. Basically, the DNI for pantoprazole is not as complicated as amlodipine. And in addition, the reading through drugs.com itself, very limited information for DNI of pantoprazole itself. But what we could found is that the consumption of pantoprazole in long-term period, it make the body more difficult to actually absorb vitamin B12, and so it's result in deficiency of the vitamin. So at the same time, pantoprazole can also cause the patient to be more likely to have a fracture bone while taking this drug consistently. Hence, it will also cause the calcium deficiency for the patient itself. However, this is just based on our assumption because of the fractured bone for the patient who take this drug in a consistent long period of time. So moving on into the monitoring and evaluation for pantoprazole. So consultation with a physician is needed if the patient want to take for a longer period, because the prolonged usage can cause the retard absorption of vitamin B12 and calcium. And the co-administered with vitamin B12 and calcium are needed when taking this drug. And diarrhea may be a sign of new infection from the prolonged usage of pantoprazole. So if the patient found that the stool is watery and has blood in it, the patient need to report to the physician so that the further intervention can be made for the patient. So in conclusion, it is found that this both pantoprazole and amlodipine has its own drugs nutrient interaction, and it is very important for us as a dietitian to ensure that the food intake and also the drug intake should be considered equally, so that there is no other effects on the drug nutrient interaction itself. So that's all from us. Thank you so much for watching and have a nice day.